was a global ask to talk about vaccines. So I'm going to build this talk in a couple of different forms. But before I do that, you know the drill, drop the questions in the chat. And I do know you're probably all dying to hear about what's going on with COVID in lieu of a new data that we have a rapid uptick in cases everywhere, particularly in Northeast, including our own areas. So you will be hearing about this more. I'm glad we talked about the new variant, the Ares, last week, because it does seem to be as the fastest growing strain. As I said before, I don't have anything new, meaning that it's about the same virulence, meaning it's not as bad in terms of causing the severe illness, but it's even more contagious than the prior forms of Omicron. So, and jumping right into the talking about vaccines, let's talk about the COVID vaccine first, because I just want to get this out of the way, and then we'll talk about other things. So, so Benit is correct, since I'm also monitoring the chat. There are other variants right now, and there is several new ones that consider to be not being the Omicron lineage. So I think we will be tracking those, of course, as the time goes forward. Those are still in a small amounts. So, you know, I'm not going to talk a lot about something that may never materialize into be a significant concern. So plus, you know, the other big problem, as we discussed before, not everything is tracked now. So we do have a number of strains that are not tracked as aggressively as it used to, just because statistics no longer track the same way as before. Most of the cases that get diagnosed, they're not getting counted anymore. Most patients don't call and don't report. So there you have it. Okay, so the COVID vaccine update. I don't have any new policies or new proposals in terms of what I recommend to my own patients. If you've had a last booster less than a year ago, I would still hold off until the new one comes out, and then do about once every 12 months. We already talked about the fact that there has been some circulating concerns about frequency of administering any vaccines. With the flu vaccine, we have not seen this being an issue because it's at most you take it once a year. There's been concern about what happens if you take, say, a COVID vaccine every few months. And there are some voices that are rapidly raising possible concerns, saying, look, it's not necessarily better. So I'm going to post something that Elisa found. Thank you so much for that. This is Donnie Jens. Donnie is he's not a universally accepted figure, but he is well-known herbalist, and he posts a pretty high quality articles on his webpage. I didn't fully read this, but I have seen similar concerns about triggering certain types of immune system with excessively frequent vaccines, and potentially in the long run not having any benefits. So
Misha, you're muted for some reason.
I guess I clicked it by accident. Well, thank you. Where did you guys lose me? I don't know. Nobody knows. Okay. So also, I'm going to post my popular video that talks about sort of the current data that the natural immunity seems to be better at long-term protecting us, and the vaccines just simply don't work for very long. And so Harry, there you have it. You have two opposite coins, right? So two opposite points where one says don't take vaccines frequently, and the other one said wait a second, but vaccines don't work more than a couple of months. So what are you going to do? So I'm not changing my recommendations. I think once a year, unless you have a very specific reason. And there are only two reasons currently that I am suggesting. One, if you're going to travel to a very high risk area and you know you won't be able to protect yourself in any meaningful way, I think it's reasonable to get an extra shot. And two, if you have a condition that would be considered a very high risk. So those are severe immune compromises, organ transplant on medications for transplant or immune suppressants, Cancer undergoing cancer treatment, cancer survivors are not, cancer survivors are not counted in there. And anybody who is on a very strong immune suppressants, be it rheumatologic diseases or anything else. And, those patients who are at much higher risk like this, I think you really need to talk to your provider. I make those decisions on individual basis, and that's that. Now, we don't exactly know when the updated vaccine is coming up. According to Pfizer and Moderna, we know it's going to be in about 2 months time from now. So this would put us somewhere in mid to late October, which kind of corresponds to how it was outrolled last year. I want to keep moving. Let me check if there anybody have questions. Otherwise, I will go to other vaccines. Okay, no questions for now. So for this part, what I'm going to do, I'm going to show you how to think about this first. So I'm going to go ahead and share my screen. Okay, so I'm going to show you some of the CDC recommendations and CDC pages. And I think that's probably the best way. And of course, we'll make sure that you can get this access. So I'm going to post right after I'm done. I'm going to post all these links for you in the description, and then we'll post that as part of the video. So, okay. So one thing I want everybody to sit on the chairs, don't fall off the chairs, because if you kind of look at what government recommends, you would say, wait a second, that's like so much, then I'm not, it's too scary. All right, so you have to put all this in context. For many of these vaccines, and I know it's too small, so don't worry about it. But for many of these vaccines, like for example, Haemophilus influenza type B vaccine, you probably had it when a long time ago, and you really don't need it anymore. For some vaccines like hepatitis B, if you never interact with blood, and you've never had it, the chances are slim and you don't need to worry about it. Or for hepatitis A, for example, if you're not traveling somewhere where there's a high risk, you're not working in a healthcare settings, it becomes a very questionable, even though that, yes, government recommends it, but then you have to be very kind of clear what is your personal take on this, or your personal risk rather. So this is the actual timeline. And so you can put yourself in a category. So I don't know if we have anybody from 19 to 26, but if you do, then you kind of look down and you see what you should be getting, right? And again, as I said, a lot of these vaccines, particularly if you look at the measles, mumps, and rubella, or so-called MMR, I'm sure everybody here gotten them, so there's probably no point discussing them. So let's talk about what you actually should be getting. Well, the first one, if you have your garden, if you live on a farm, if you ever get outside and you have any chances of your skin being penetrated by something that would carry potentially tetanus bacteria on it, you absolutely should be getting every 10 years boosted. And there is no endpoint to this booster, meaning every 10 years you should get one. You don't need to worry about this one. So now the big one, the varicella. There are two vaccines. The older one, we're just calling it varicella. And the newer one, what's called the zoster recombinant. And I will be okay to say the trained name here because it's the only one, so that otherwise you will never really realize what the name is. So the name is Shingrix. So that's the name of the current vaccine. I actually don't know exactly, but recently it's been approved by Medicare without any particular additional approvals. Before that, you had to get a specialized approval. Vaccines getting very expensive, and because of that, unfortunately, that was not often accessible for some patients. So now everybody should be able to get this. It is 2 shots, at least a month apart. More is probably better. 2 to 3 months is usually what I suggest, but minimum 1 month apart. And they are quite effective. And the question becomes, there's only question about the zoster goes like this. Okay, so if you're 65, 70, 75, I think everybody should be considering that. But what if you're 85 or 90 and you never had it? Well, that gets a lot more complicated, because at that point, at that age, the severity of zoster is going to be less. And the protective mechanism of vaccine beyond 80 seems to be dwindling it somewhat. So we usually then I'm going to just talk about myself here because it is actually not a general recommendation. I start risk prioritizing a lot more. Sometimes what I would do, I would actually check the antibody titer in the blood during the routine annual blood check. And if I see the patient still has a very robust level of disaster antibodies, be it from natural immunity many, many decades ago, or from the prior vaccine, it doesn't matter. If I see that, I sometimes say, forget it. I don't think you should be getting it. But again, if you feel strongly to get this, there's no really end ceiling to it. And now that it's covered, I think there's more reasons to get it. Okay, so next one is a big one, is the pneumococcal vaccine. And you should be asking me the following. Well, I've had some, right? So am I done? Well, not so fast. Chances are, you probably had an older vaccine, whether it was PCV 15 or PSV 23. Nowadays, the recommendation is that you can either do that. So if somebody has PCV 15, you can give them another one, this one, or you just give one dose of PCV 20, and there are no more second shots. So if you had those two, or you had this one, you're done for the rest of your life. There is occasional specific cases when patients are severely immune compromised. Sometimes we do add something, but beyond that, at this point, things have gotten simplified. So there's just for now going to be one shot. I'm skipping all of that completely. I'm not going to talk about meningococcal vaccines. Those are very not easy to talk to. So we're just going to go back up and talk about flu. So yeah, the flu shot, recommended for everybody. It used to be, we were saying, get it when you're 65. Nowadays, as you can see, government says, well, if you're adult, go ahead and get it. By the way, the yellow color means recommended. The purple color, so you have to have some additional risks. So basically what this means is that if you are less than 65, you have to have something else going on to get a pneumonia shot, something like a lung disease, but if you're over 65, everybody getting it, and there's no, now this interesting idea of a blue square, which means recommended with clinical decision-making shared with the patient, it's a very funny gray area, and only gray ones are not recommended. So we're not going to talk about those. Okay, so how do I make decisions about flu shots? So here's how I think about it. If you've had flus before and it went really bad, and let's say you're 64, go ahead and get it. As you can see, it's, by the way, recommended, but it's recommended for everybody. If you work in healthcare settings, or if you have someone that really would get sick if you expose them, definitely get it. And it doesn't matter what age you are. But what if you 65 or 66 or 68 and you're completely healthy? Well, it gets a little trickier, because in the worst case scenario, you're going to get a flu and it's not going to kill you. But if you have any risk factors, particularly risk factors that can cause a significant organ damage, like let's say you have an asthma or COPD, those are the cases that I really try to push all of my patients to get an annual flu shot, because we know that the risk of dying from flu-related complications, secondary pneumonias or secondary other infections, gets pretty significant. So that's a critical aspect of getting a flu shot. Okay. All right. As you can see, all the COVID shots are now in yellow. What does that mean? Well, simply means, yeah, so, it kind of doesn't matter, give it to everybody. As you know, that's a CDC recommendation for 2023. This is not a WHO that's taken a little bit of a different stance. So my recommendation is follow the CDC for COVID, and that's what we've been talking. All right. So there are a few things left that is worth covering, and we already covered this. So what are you guys noticing that is not here? And by the way, this is pretty updated. I will tell you 1 second when they updated it. So if you go to this link, so this is 7/24. This is the, actually, if you come back here, let's see, when was this updated? Actually updating at different times. So if you look at I gave you the table which I think is this one. They don't put the date of update here, but you can see all the dates of updates for each vaccine. Okay, but so let's stay on this page. So what are you not seeing here? Or here for that matter? Anybody? Of course, everybody wants to hear about it.
Is shingles on there?
Yeah, we talked about shingles. That's the zoster. Zoster is the shingles.
RSV.
RSV. So what's the RSV story? Well, so you hear about it everywhere. You hear get RSV, get RSV, get RSV, right? That's what you're hearing. Well, first of all, what you're hearing is almost exclusively recommendations by somebody affiliated with a company that makes RSV vaccine, which costs, by the way, about $350 a piece. I don't know about insurance coverage. I presume that it's covered. However, it concerns the hell out of me because when they claiming that they recommending it based on efficacy, they're not providing a large, significantly well-designed study to support that statement. So I am literally telling you, I will be waiting for the CDC to come out recommendation and to tell us what they base this recommendation on after appropriate experts, not me, who will review this and say, okay, this is legit. There are a lot of people out there saying, go get RSV this year. I don't know. I am not jumping to this until I hear clarity that indeed it is effective, safe, and there's a significant amount of experts who will support administering it. Now, again, it's possible that CDC will suddenly make an update in the next couple of weeks about it. But okay, but there's one category of people to whom I will be recommending RSV vaccine, and I already been recommending it to a few of my patients, and that's particularly people with a chronic lung disease of any kind, whether it is a chronic asthma that is not well controlled and you have a frequent attack, chronic COPD, lung cancer, and anything that's chronically affecting lung disease, whether it's a common or uncommon illnesses. So keep that in mind. If you do have one of those conditions, it's actually quite wise to consider this vaccine. The last year RSV was brutal. I had a case for sure. My entire family had, my older son and I. It wasn't pleasant. It turned into bronchitis. Would I have taken the vaccine if I knew? Probably, because I would rather have a little bit of side effects of the vaccine than what happened when I got the bronchitis for almost a month. So with that in mind, let's see what the questions are, because I am done. Yes, Jennifer, got that. That's RSV. All right. Okay, so Cecilia is asking interesting direct question to me. So I don't remember having symptoms, so what should I do? Well, so if you're concerned about getting another vaccine, go get a titer. This is exactly a great case where when you go to see your doctor next time and you have this concern and you don't know what to do, you can ask for the herpes zoster viral titer. And if you have a very strong reaction, your antibodies are very strong in the blood, you know, it's not really clear how much more benefit you're going to get. Remember, when the studies are done, nobody ever checks the titers. They're checking titers as a result of the injection, but they're not really checking titers before the injection. Why? Well, because if you design the study like this, and it's an important question, but it in a way going to negate things and it's going to overcomplicate the recommendations. So if you're saying, look, test first, and then based on this cutoff for the titer, give a shot, it makes the whole process a lot more costly and a lot more complicated. So running the titers really needs to be prioritized on an individual basis. For example, zero reason running a titer if you just had a shot, or if you just had within the last couple of months, you had a flare, you had an actual acute shingles attack, because the antibodies are going to be very high. But it's a good question. Why take COPD and flu shots at separate times? I'm not sure I understand the question. There is no COPD shot. COPD is a disease. I think you may be meaning, why take pneumonia and flu shots together, separate? Okay, I recommend every single vaccine to be taken separately. I don't care what it is. Combining vaccine, or whether it's COVID vaccine or it doesn't matter. You're straining your immune system. It's already overthinking what to do with the shot you just got. The reason you hear a lot of places pushing to get multiple shots together is only one, and it has nothing to do with evidence, nothing to do with clinical. It's a pragmatic approach. Certain patients are hard to get to clinic. It's always a lot easier and cost-effective to save the visits. It's a lot better for the system as a whole because giving multiple shots on a repetitive basis is going to additionally strain the system. But nobody thinks about your own health at that moment. Like the system does not care how that increases the side effects. That's never been studied. It's never been studied. You can take a COVID and flu shot together, and it never will be for one very simple reason. If they've shown that the vaccine is safe individually, nobody will combine them and try to give them together to prove that they're safe. Remember, we live in the United States of America. The burden of proof lays in toxicity, not in safety. If we were in Europe, politician could have pointed that out and said, wait a second, we are administering them together, so we have to study them together to prove safety. Remember, in US, the burden is on the toxicity. In Europe, the burden is on safety. So you have to show that particular chemical or particular treatment is safe before you can implement it. In US, you actually have to prove that it's toxic before and that's been like this now for I don't know how many decades, and I don't expect that changing. But again, my general principle, never combine any vaccines for any reason unless they're already combined, right? So something like a Tdap or TD, tetanus and diphtheria combined, that's okay, because that's just how they formulate it. You don't have a lot already options there. Although, frankly, I'm not worried even about that. In fact, the tetanus is one of the hardest vaccines. So it has a lot of side effects. And it may be that part of the reason is because there's more than one in there. Nobody knows for sure, but that's one of the possibilities. Okay. Anybody else? So I guess I'm going to stop mute sharing and bring back and see if anybody have questions. Okay. Is there any benefit to getting a different COVID vaccine this fall from what you previously got, like getting Novavax if you're previous? Yeah, I actually don't know. Rick, this question came up before, well, I guess last season for sure. There were some voices back in the day that were saying, yes, it's probably a good idea to kind of broaden the possible protective mechanism. But I actually don't think that there's any data to say that that is correct. There was one or several articles more than a year ago that I reviewed that were suggesting that there is a potential benefits of crossing over. I have a feeling that even if there is a benefit, it's probably going to be very, very small. So the party line currently is don't worry about it, get whatever convenient, or get the one that's perceivably a little safer. So that's another way to think about this. The efficacy seems to be identical between Pfizer and Moderna and slightly better for Novavax. But the safety, probably the Pfizer seemingly has the best safety. Again, that difference is very, very small. Like what does the 2-3% in difference in chances of moderate side effects really represent? It's very hard to say. Most of those moderate side effects is just like fever and malaise for a few days, right? So they're not life-threatening by any stretch. And so the life-threatening side effects like Guillain-Barré, for example, which is a kind of ascending paralysis, those are exceedingly rare. And I don't think there's any reason to say, well, this vaccine is worse than that, right? So pick it based on your pragmatic approach to this. If you had a bad reaction to one vaccine, try the other one. I mean, that's basically what I'm going to say. Yeah, so there were been studies done showing that that's basically roughly about the same efficacy. So they've looked at the data between saying with the same or crisscrossing different ways, and everything seems to show roughly about the same efficacy. That's why, there was a period, I think more than a year ago, when we were sort of I was trying to say, probably Pfizer better just because it seems to be slightly safer. I'm kind of walking away from that statement because the current boosters seemingly quite similar in terms of their safety. The original series of vaccines, I think Pfizer was slightly less side effects prone. The current boosters seemingly close. But again, if you're very concerned about side effects, you should probably be potentially considering not getting anything, because in reality, you're still going to have some partial protection, T-cell protection from your prior boosters. and or from your original COVID if you've had it once at least. So, all right, I think I'm not seeing any new questions, which means that, and we're right at the half an hour. Thank you everybody for good questions. I hope I covered this well enough. If there's any areas of vaccines that left you sort of, wait a second, I don't understand this, feel free to email us. You can also post this directly to me or put it still in the chat. And if we have time at the end, or maybe I'll take it to the next week and we'll continue conversation. And where is Kath? Oh, I see. Jennifer, you raising hand? No. All right. Catherine is coming. So let's just make sure we spotlight her. There we go. Hi, dear. Well, thanks so much.
Hello.
Always highlight when you're here. So,
thank you all for
you.
having me back. And thank you, Dr. Kogan, for that wonderful talk. Hello, everyone. Thank you for joining us today. I'm going to lead a body-mind practice, excuse me, this afternoon. And I was telling Jeanette, I actually visited a botanic garden earlier, so I think I might use that as inspiration for today. So I invite you all to come into a comfortable seated or reclined position. If you need to take the next moment to adjust yourself, to move where you are, please feel free to do so, or perhaps to gather any props or supports you might need, pillows, cushions, blankets, anything that you need to get a little more settled and a little more comfortable where you are. You can close your eyes, hold a soft gaze forward, or keep your eyes open, whatever helps you feel safe, you feel comfortable, and helps you feel relaxed. And when you're ready, I invite you to take a deep breath in through your nose. Exhale, breathe it out. Maybe feel your shoulders and your chest fall away from your ears. Feel them relax and settle just a little more. Taking 2 more breaths as you're ready. Deep breath in through your nose. Feeling the belly, lungs, and upper chest expand and open, and exhale, sigh it out. Release, let it go. Once more, deep breath in through the nose. Deep breath in. Maybe notice if your body, in your spine, in your chest, maybe even in your arms, your shoulders, they feel a little softer. They feel a little more at ease. Allowing yourself here and now to breathe gently in and gently out. Noticing the path of your breath. Noticing your breath just as it moves in and as it moves out. In through your nostrils and down into the lungs, all the way down to the belly. And as you breathe out, notice this path reversing. So here, just breathing in, breathing out. There's no right or wrong or perfect way to do it. Just allowing yourself to breathe and noticing. Noticing yourself breathing as you would your favorite flower, or maybe an animal out in nature, just observing it without judgment. Noticing what it feels like to breathe. We do this without thought throughout the majority of our day. just following it. We'll continue this for another minute or so. Just breathing in and breathing out. Breathing in, breathing out. Taking 5 more gentle rounds of breath here. As we breathe, we're going to transition into a guided visualization. And our visualization is going to take us out into nature, into a garden. I invite you to imagine yourself in a garden of your choice. Perhaps it is your own garden, or maybe a garden out in public where everyone has access to. Maybe it's a garden from your childhood or in a very special place, or maybe imagine yourself in a garden with all of your favorite flowers, creating this garden in your mind's eye. Take a moment here to allow yourself to be welcomed into this garden. Maybe you're sitting on a bench. Maybe you're sitting on the ground amongst the flowers and nature, or perhaps you're walking around. As you're welcomed into this garden, I invite you here to take a deep breath in, smelling the fresh air, and taking a look around, taking in all of the sights. Noticing what is in front of you, what is around you. Maybe it's different flowers, plants. What is on the ground? Is it soil, dirt, grass? Maybe pebbles or a walking path? Observing the colors around you as well. Are they vibrant? Maybe reds, greens, yellows, purples. Is the sky blue with the sun shining through the clouds? Or is it more of a cloudy, maybe a little more dreary day? Are you there at sunset or sunrise? Taking it all in, creating this image in your mind, this perfect day in a garden. Do you feel the breeze against your skin or your hair? Are there birds, butterflies, bees buzzing around? Are there other animals in the garden as well? Bunnies, chipmunks, maybe even some ducks or geese. Who is welcomed into this garden with you? Take the next minute or so to continue observing. Feel free to smell any flowers. Perhaps touch them in your mind's eye. What is the texture of this nature around you? Do any animals come up to visit and greet you? Maybe a butterfly landing on your hand, or a bird stopping by to say hello. And finding a place, a position where you can be settled in this garden as we prepare for a guided body scan. As I say these different areas of the body, I invite you to just observe them, notice them without movement. If it's sunny in your garden, maybe even imagine if the sun is radiating down on these parts of your body. I invite you to draw your attention to your right hand thumb, index finger, middle finger, ring finger, pinky, I apologize, everyone. My computer decided to shut off. Jeanette, I don't know if you're still there. I apologize.
I am. You're spotlighted again.
Okay, should I finish or should we stop there? I'm so sorry.
Keep going. Keep going.
Okay, sorry. So we are still in our garden. Again, drawing your attention to your right hand, right wrist, elbow, right shoulder, whole right arm, hand and shoulder, whole right arm, hand and shoulder, neck, left hand thumb, ring finger, pinky finger, whole left hand, wrist, elbow, left shoulder. Notice whole left arm, hand, and shoulder. Whole left arm, hand, and shoulder. Back of the neck. Back of the head. Notice without movement the crown of the head. Forehead. Eyebrows. Eyes. Nose. Notice the nostrils as you take in breath and as you exhale. Right cheek, left cheek, right ear, left ear, lips, chin, whole face and head, whole face and head. Throat center, neck, shoulders, heart center, front of the heart, back of the heart, rib cage, stomach, torso, hips, right hip, thigh, knee, calf, ankle, right foot and toes, whole right leg, hip, knee, and foot, whole right leg, hip, knee, and foot, left hip, thigh, knee, calf, ankle, left foot and toes. Notice whole left leg, hip, knees, and toes. Whole left leg, hips, knees, and toes. Notice and sense entire upper half of body. Entire upper half of body. Notice entire lower half of body. Entire lower half of body. Notice whole right side of the body. Whole right side of the body. Whole left side of the body. Notice whole left side of the body. Whole front side of the body. Whole front side of the body. Whole back side of the body. Whole back side of the body. Now notice and sense the whole body all at once. Whole body. Whole body. Breathing into this space of self-awareness and observation, allowing yourself to rest here, still in your garden, still in nature. Nothing to do, nowhere to go. Just breathe. Just breathe. Continue here for the next 2 minutes. Breathing at a pace comfortable for you. Allowing yourself to rest. Be at ease. Just breathe. As you're ready, I invite you to gently begin to deepen your breath. And just taking notice of where you are in your garden. You're preparing to say goodbye, but knowing that you can always come back to visit this garden at any time of your choosing in your mind's eye. Feel free to say your goodbyes or see you later to any elements of nature that are with you in your garden, any flowers, any animals, just this entire place as a whole. Beginning to make any small gentle movements or stretches as you're ready. Perhaps in your hands, your feet, your arms, your spine, your head and neck, anything that you need as we now begin to come back together in our virtual space. Opening up your eyes fully and completely when you're ready. Our guided visualization has now come to an end. Thank you all so much for joining this and for bearing with me as I had a momentary technical difficulty. Thank you.
Thank you, Catherine. This was delightful. Thank you so much. So this was progressive relaxation techniques. They're very powerful methods, not just fall asleep. That usually happens when I do this. So I only do a portion of it. Otherwise, I'll be not able to come back. But also just during the day, especially when you feel tense in any specific area. Okay. We'll see you next week. Who do we have next week?
Next week, we will have a new speaker. Her name is Amy Santis. She is a mind-body practitioner. I'll send you some more information on her next Wednesday. And she may also be doing the mind body practice. I haven't figured things out yet, but never you mind. Have a great weekend.
Right. Bye, everybody.